I'm going to go through this quickly. I want feedback. I want this audience participation if at all possible. And I'm going to get you out of here today so you can get to lunch as well. So those are all the goals. But I want to give you an overview of what we've been trying to do in preparing for the future. And first, give a little bit of setup for some of the reasons why this is important. Looking behind the curtain, the reality, and I'm sure that this isn't news to you, but I'm just giving it up there to underscore it. The reality is that we no longer have a farrow-to-finish industry. We've got farrow-to-finish operations, and we've got people that operate in that, and that's fine and that's great. We've got a really diverse industry in the U.S. But we're moving pigs all over the country every day, somewhere around, estimated, and it is a swag, it's really a guess, but somewhere estimated 600,000, maybe 700,000 or more pigs are on the road around the country every day. Every day we're moving our animals. And an example, in Iowa alone, in 1 year, 27 million pigs moved into the state from 33 different states in Iowa alone. So we've got a national industry, we've got a national production system. And when you look at a national production system and the movement of pigs around, it's the perfect way to spread disease. We've got pigs going from one area to another area and all around. That's part of the issue with our viruses. That's part of the issue with PED. It's part of the issue with what we've had going on. And as we've built this system, we've built the system to the benefit of the pig, to the benefit of the pig, to the benefit of the producer. This system has evolved. Would we build it like this if we could start over and say, how are we going to make it happen? I don't know. I'm not so sure. But the reality, this is the reality, that moving those pigs and PED and other diseases coming in, we have to prepare for that. We have to be better prepared for the reality of what's going to come in our future. And that's that is the reason for the Swine Health Information Center. To learn the lessons of what we've had before, to be better prepared for what we know is going to come. There's a lot of lessons learned from the PED experience, and everybody that's been working in this for the last 2 years has their own list of lessons, and it's much longer than 3 pieces. But for mine, highlighting 3 lessons is what I want to do. The first lesson is that we don't know where PED came from. We're not going to be able to find out how it got into the country, in spite of the best efforts of USDA, in spite of the best efforts of us, the industry, the associations, in spite of very smart people trying to figure this thing out. The reality is that we don't know how it got here. We know by analysis where it came from. It was a Chinese virus, but we don't know how it got here, and that's the simple reality. So, if that's the reality, the lesson to be learned is the window's open. We can't shut it. We don't have the ability to shut it because we don't know what window to shut. And the simple thing, one of the simple things that the messages, one of the simple approaches, seems simple, is, well, let's just test everything that comes in. And so we don't get anything, we don't get the next one. Let's make sure we don't import any more of these diseases, any more of these viruses. There is so much coming into the country, coming into our production units, so many inputs that we just can't track them all. When PED was introduced in Hawaii in December of last year, it was the first case in Hawaii. Those of us who were working on this thought, finally, here's an isolated case. It's in an isolated system. My gosh, you can track things that go on and off the island. We're going to finally find out how PED can be transmitted from someplace where it's endemic to someplace where it's not. Not just around the country, but someplace different. We couldn't even figure that out. There were too many inputs, too much that there was no smoking gun even in that isolated situation. If there's no smoking gun, We got to be prepared for the next one because the next one's going to come. Second lesson is we can't rely on state or federal governments to do this for us. They're partners, but we've got to have some industry responsibility to do this ourselves, to address this ourselves. Avian influenza has taken a lot of focus, a lot of effort from USDA, and it's a big, big deal. Should we get another virus into this country during this outbreak of avian influenza, where would those resources be? We've got to have some responsibility for ourselves, for our own industry, for our own producers, to put things together to help manage and help prepare for what may come next, what will come next. The timing, we don't know. It might be next week. It might be in 5 years. I don't know. But something's going to come next, and we have to be better prepared because we can't expect USDA alone to do this for us. Another lesson from PED. We had to work together with USDA on PED to get it even to the spot where it is now, but we can't rely on somebody else to take care of things for us. The third lesson is that state-federal industry cooperative and coordination. And that's part of informing those three entities and them sitting down for a response plan and figuring things out. So that's really the outcome of the other two, being prepared, working to be prepared, working with ourselves, and agreed upon how do we go forward from here. Another lesson from PED. All of these things we learned, the first two took us too long to address with PED. It took us too long, and well, I will say, and I've said it multiple times, I'm firm in my belief that there's no way that our country, the producers, USDA, our researchers, anybody else, could have responded any better than we responded given the resources and information we had at the time that PED broke. And that's an important phrase, given those resources at that time. We can do better. And that's the whole idea about the Swine Health Information Center. How do you put together the infrastructure to be able to do better the next time so we can respond more quickly? So the first thing you got to do, if you're going to respond quickly to something, it really helps to have kind of a heads up on what you think is going to happen and what's going to come at you next. PED showed up in April. We found it in May of 2013. First case in April, but it was identified in May of 2013. In March of 2012, the American Association of Swine Veterinarians had a swine health meeting, and at that swine health meeting, they talked about diseases circulating around the world, and PED was one of them in March of 2012. And we talked about it, and we said, this is bad, it's in China, here's the signs, here's what's going on. And everybody nodded their heads and said, it sure is a good thing we don't have that here. And we went away. And we went away and thinking, golly, it's a good thing we don't have PED. And then it shows up. So it wasn't necessarily a surprise. What we've got to do is we've got to do a better job of looking, and we've got to take that information and do something with it. Not just gather it, but figure out what to do with it. And so that is the Swine Health Information Center. That's what we're going to be working on. The first thing is to look over the hill, this global swine health and issues identification. Look over the hill. Look around the world. Put a network together of information gathering so we've got better intelligence about the things that are out there, not in the country, that are out there that are going on. And that intelligence will feed into the Swine Disease Matrix Project. That intelligence will feed into, this project is a list of 40-some viruses. And we can't do 40-some viruses with all the things we have to have, so we have to prioritize that list. We use the information, prioritize this list of viruses, and then figure out whether or not we have the capabilities to be able to detect and respond to the most likely viruses coming in. That's what that matrix project is, to prioritize the list of diseases and to develop as best as possible, probably not kits, but at least reagents and other diagnostics that will help us detect and help us respond. It took us 4 to 5 to 6 months after we got PED to develop and distribute and put into place the good diagnostics that we had at that time for PED. And like I said, truly, I don't believe that that could have been done any quicker. The land-grant universities, veterinary diagnostic labs dropped everything they were doing and responded to the need for this. The pork board, with checkoff money, started with $1 million, put in another $2 million. We put in over $3 million over the last 1.5 to 2 years into that research effort. So your checkoff money went right into this right away. The veterinary diagnostic labs responded to this right away, but it took us time. The Swine Disease Matrix Project, in coordination with monitoring, is going to prioritize and then look at the most highly likely viruses that get in here and not repeat the mistakes that we made with PED or that delayed process, and give us diagnostic capabilities before we need them. We may not need some of them. And Lord knows, I hope we don't, because you don't want some of these things in here. But if we get them, we've got to be better prepared. So that's what that Disease Matrix Project is. Also, over here, the swine health data analysis and monitoring for trends. The other thing that we learned from PED is that when producers talk to producers about the status of their farms, the infections that are happening out on their farms and what's going on, we were way better managing PED than what we would have been alone. People talk to each other. Show me yours and I'll show you mine, type of thing. That was central in getting a handle on this thing and helping us to analyze that data, that shared information and that data in order to help producers protect themselves, biosecurity, immunity, all the other things, research on their farms. And so that's the other thing that the center is going to do. The center is going to help facilitate that producer communication from producer to producer. And 3 things. Global monitoring. Second thing is research with better diagnostic capabilities. And the third thing is to provide producer to producer communication and analysis of that data in a secured manner, voluntary information, but analyze that voluntary information in a secure manner so producers don't have to be concerned about confidentiality issues, about somebody building a grand database someplace and something happening to it, somebody getting into it. There will be no grand database with the Swine Health Information Center. It will be availability of data from farms voluntarily for analysis, not to build a database and hold it someplace. Feed that back to producers and the veterinarians so they can affect the health, they can be prepared for what they know is around them and what they know is coming. They can be better prepared with biosecurity, with herd health plans, and that will affect the health of their pigs on the farm. That's what this scope of work is about. All of that information, the Swine Health Monitoring Project, is that producer-to-producer communication project that's going on right now, coordinated by the University of Minnesota. It's a great way for producers to simply talk to each other and share that kind of information. A very secure way, and the center isn't about to take that over. What the center is going to do is going to help make that better. Facilitate what's going on, use the basis of that University of Minnesota information sharing. And that's national sharing, it's not just Minnesota. But use that basis of information sharing and build on it. So you are more comfortable and more confident in being able to share information and then get feedback about animal health that's going to help you on your farms. That's what the Health Monitoring Project is. The emerging disease monitoring data will be part of that feedback from veterinary diagnostic labs and other places about maybe some ears up, some antennas up on maybe there are trends that are happening here in the country that we can analyze and give us an early warning system for something else happening. So we're going to look at that kind of data. we're going to look at, and this Production Animal Disease Risk Assessment Program, the acronym is PADRAP. It's a risk assessment that you can use on the farm to help you identify risk areas to improve biosecurity. We're going to look at how biosecurity risk assessment can fit into this whole information sharing system for all of this feedback loop coming back to producers. Finally, as producers and the veterinarians, as you guys and your veterinarians get comfortable, get confidence in this system, see the results, the Secure Pork Supply, the Secure Pork Supply database is a plan for response to foreign animal diseases like foot and mouth disease, classical swine fever, African swine fever. Those are beyond the scope of the Swine Health Information Center. USDA has control of those, and we know the plan when that happens. But all of this information and all of this infrastructure of preparedness is going to help feed into the process to be able to better respond to foot and mouth disease and to classical swine fever or something else bad like that we're going to get in the future. The Swine Health Monitoring Project, to give you a little background on that, this is the epidemiological break curve from 752 herds, over 2 million sows. It's not a statistically valid sample of the U.S. herd, but when you're talking about 2 million sows, you got a pretty darn good database there. And that's the outbreak curve, starting from May of 13 until about now. And you'll see worst part was in March of last year, and we're very low right now. It's the kind of thing that can help us track what's going on out in the countryside. But it also helps us share information and analyze what's happening. This is a report from those farms that are participating. And what they do is they report their herd status. The green is negative. Nobody's infected. The red is active infection. And so you saw that epidemiological curve. And that's what happened in March. We started out with everybody negative, and we went up in March and there was a peak. This part is the interesting part. And this is the part that the Health Information Center, the kind of analysis that the Health Information Center is going to do. That part, that dark yellow, is the report from those farms that are using live virus to expose the gilts before they go into the breeding herd. Live virus to expose the gilts, and it's a good technique. You know, that's feedback. They're using feedback to expose the gilts, increase immunity before they go into the breeding herd. We've done that for decades, and it was a very valuable tool at the PED outbreak. What this is showing us is that from this start, more and more farms have been using that technique. What does that tell you for the future? That tells you that if we're going to go back to this, and if we keep this line down very low, we still have risk out in the countryside because live virus is being used to expose gilts. So we still have live virus out there. It still is a risk, and we've got to be able to manage that risk. It's part of the information issues. So the question becomes, how do we share that information? How do we react to that information in order for producers to understand that there's still risks out there, and essentially what it amounts to is maintaining biosecurity. Biosecurity was an easy message right here. When that thing was hot and flying, biosecurity was an easy message and everybody paid attention to it. And that's why we're so low. But as we go down here, it becomes old business. And maintaining that, because there's live virus out there, is a very, very important issue to managing this disease in the future. I'm putting these up because these are the logos of the companies that are involved in this Swine Health Monitoring Project, and giving them a shout out for their willingness to publicly acknowledge that they're part of information sharing. That's where we've got to get. That's what we've got to do, and that's what the Swine Health Information Center is going to try to do. So, summary, identify the biggest threats, be better prepared, diagnostic capabilities, better aware of how to respond, inform producer decisions. When we get right down to it, the whole deal here, for you guys out on the farm, the whole thing is to help inform the way you act, you and your veterinarians act on the farm, because that is the piece that's going to make a difference to the health of your pigs, and that's the piece that's going to make a difference to you and the productivity and your ability to make a profit. Inform producers' decisions by sharing information and analysis of that data. Swine Health Information Center has been funded by checkoff money. $15 million of checkoff money was allocated to this project over a 5-year span. It's got a 5-year life. And although it's checkoff, it's completely separate from the National Pork Board. It's not a National Pork Board entity. It's not a National Pork Board project. It's a separate nonprofit corporation. And as a nonprofit corporation, it's got a board of directors. The board of directors are made up of people from the National Pork Board, National Pork Producers Council, American Association of Swine Veterinarians, and at-large producers from across the country. Group of thought leaders, they're going to take this $15 million and help shepherd it through this project over the 5 years. And I'll tell you, at the end of the 5 years, that effort, the purpose for this is going to be used as a model for future swine health production, swine health issues. And at the end of 5 years, I'm confident that the funding is going to come in as the return on investment is shown over that 5-year process. So we've got $15 million to do this research, big research effort on this thing over the next 5 years. But we're going to look at even longer term of the future over those 5 years with the help of these folks. And I'm going to tell you, this is an audience participation program. Producers are the ones that are going to drive this. We're going to give you the opportunity to participate, the opportunity to take advantage. Maybe that's the best way to put it. We're going to give you the opportunity to take advantage of this for your pigs. I can't make you do it, but we're going to give you the opportunity to take advantage of this. And as you take advantage of this, the return on investment you will see will be there, and it will help on the farm as we go. So, finishing up, lessons learned from PED, how's it changed our future? USDA's also learned a lesson, and they said there's a federal program now to mandatory reporting for PED infections. USDA has also learned a lesson, and they said, at the beginning of this, we didn't know, we had no mechanism for reporting of these emerging diseases. They have a proposal for a USDA organized method for mandatory reporting of emerging diseases. That's only a proposal at this point. A lot of detail to be worked out there, but lessons have been learned not just from us, but from others. Dr. Max Rodebaugh, veterinarian in Indiana, presented this at the American Association of Swine Veterinarians with his view of how we will be different going forward. Nothing should impede that index case investigating that. We've got to do a better job of getting out there on that first farm that's infected in order to do the analysis to find out where it came from and also to react to it as it's there. There's got to be some method for central information and for central coordination. That has to be centralized in a manner that producers and their veterinarians have confidence in and will participate in. Disease transparency, sharing information, show you mine, I'll show you yours, you show me yours, I'll show you mine. Premises identification and electronic health certificates. If nothing else out of today, remember the plea for you to, thanks Matt, for you to pay attention to premises identification numbers. Prem IDs are something that we've got to have going on the diagnostic lab forms in order to be able to address endemic as well as emerging diseases. That's part of the communication of putting a Prem ID on everything that's submitted into the diagnostic lab. We started out with very little at the beginning of PED, and we're up now in PED cases. We have better than 90% report. The diagnostic lab says better than 90% of these PED cases have pins on the diagnostic lab forms. That in 2 years, that's amazing. 75% of all of the diagnostic lab submissions have pins on them. That's in 2 years. That is amazing. It is an example of what can happen when producers and their veterinarians say, this is an important deal. Let's just do it. So pins, more attention on diseases in grow finishing units. That's an easy spot. That's an easy spot where things just pass rather than the sow herd where little pigs will die. We need to pay more attention on diseases because the grow finishing units can be the spot where something happens. Notification is something unusual. Information at diagnostic labs and biosecurity is going to need to change. That's it. That's what we're about with the Swine Health Information Center. It's been a long row to hoe, but it's going to be the future of our industry as we go forward. It's going to be the future as a model for other commodities. It's going to help us. It's going to help you. And it's going to be something that we're going to be able to build on. So we're going to need your help as we go. And that's what I've got for the Swine Health Information Center. I think that should be it. Now, tell me what I missed. Tell me what you're thinking. Tell me if it's a good idea. Tell me if we should use your checkoff money for this kind of thing. Feedback we've gotten has been very positive, but I want to hear ideas. What have we missed? I got time as 15 minutes. 15 minutes for questions. If you got them, let them roll. Sure.
That list of the participating systems, do you have any idea what percentage of U.S. production that those systems make up?
Well, so if we've got 5+ million sows in the herd, in the national herd, that has over 2 million of those. Dr. Mike Terrell, Dr. Matt Anderson, 2 people that are on the board of directors for this. As of July, they're going to be my boss. I'm currently senior vice president of science and technology with the Pork Board. I'm resigning from that and going to take over the executive director of this as of July. So there's going to be a transition period at the Pork Board, just so you know. They're going to do a search to fill my position. The plan is, the goal, maybe I should say the goal rather than the plan. The goal is to have somebody in place at the Pork Board. As I walk out the door, somebody else is going to be walking in. And the center is still going to be working with the Pork Board, with NPPC, and with AASV to make sure we're all coordinated and everything happens the right way for you as producers and for the industry. There's a question. Thanks.
So in 2 years, nothing's happened. PDB is controlled in some fashion, and people are moving along swimmingly. What are some thoughts on how to maintain the awareness of this has already happened once and it'll happen again? Don't get lulled.
Okay, the thoughts on maintaining awareness is my thoughts on the center as we go forward. One of the first people that I want to hire within the center is a communications person. We need somebody that can take that data sharing information, that epidemiological analysis, and push it out to producers. Not just that, but all of the activities, everything that's going on. I will tell you, I believe that you guys are going to think, yeah, it's a good idea. I mean, that's just me. You're going to think it's a really good idea to look over the hill and look and see what's going to happen. It's a really good idea to be prepared with diagnostics. But all of that stuff is stuff that you've given me a promise it's going to make a difference someday. And so while it's a good thing to do, just get it done, do it. It's a promise that it's going to make a difference someday. But that sharing of information and communication back to producers with a return on investment as far as that information goes, that's a thing that you're going to use every week. That's a thing you're going to see that's going to make a difference. And that's part of, we aren't going to let this become, oh yeah, it's just another thing. We're going to maintain communications. We're going to show you the return on investment and give you the ability to demonstrate that on your farms.
Hi. great project, and I wish you all luck going forward with it. I apologize, I came a little bit too, so perhaps I missed where we're going in the beginning, but I've heard many times now, $50 million has been put towards that project. Did you share at all how you envision that budget working forward in terms of, and it's going to be primarily research projects, I think we're talking about, so you're going to be funding specific projects. Did you share, some idea of how that $50 million will be spent?
Well, so we don't have all of the details. That's something for the board to work out between now and then. But here's the buckets. The buckets, there's going to be some administration. There's going to be some administration cost. And one of the things that we've done with this, there will be an office. We don't know where that will be yet, but there will be an office, but there won't be a building, and there won't be a lot of overhead. We want to keep this thing lean and mean with very little overhead, as little as possible, in order to put the money not toward all of this stuff, but the money toward the real results. So there's going to be some administration. The biggest bucket is going to be the research effort that goes into that diagnostic capability. That'll take half or better of the money that's going to be available. The other two buckets, that there's going to need to have resources, there's going to need to be funds for that global monitoring, and especially funds to help support that information sharing. Those are the three things: the research, the global monitoring, and information sharing. The information sharing is going to be probably the second biggest bucket to the research effort.
Bi-directional, with information sharing that's from the board out as well as collecting data?
Oh, absolutely. Yep, absolutely. It's not bi-directional. It's more like a big circle. Yep. It's very fluid. It's more like a big circle. It's not going to be direct back and forth. There's going to be producers, veterinarians, epidemiologists, USDA, state animal health officials, all of those things feeding information around. We're going to have analysis so everybody has confidence in it, and then the information keeps going. Yep.
I think one thing that's really important to say, I work for the Department of Agriculture, and part of my job has been to try to reach out to our producers to obtain information. And there's reluctancy to give me anything because I work for the government. But ideally, what I'm trying to do is assist you in protecting your investment. So don't be so reluctant to give information, because we share the scorecard just like you help us sometimes with some more information. So I think it's important that we realize we're a team trying to take care of something like that we're not working against each other. And I just feel like that I feel compelled to share that, because there is some reluctance from
Yeah, of
people
course.
out there, and yet we're here to try and protect them. Without you guys, we don't have a job. We're not trying to get in there and tell you what to do with your stuff. We're here to tell you, here's what we need to do to fix it, but not because we want to take you out of business, it's because we want to see you grow. So.
If I can address that a little bit from the producer's standpoint, and I don't disagree with the word you said, that is a valuable information sharing process. From the producer's perspective, usually when that objection arises, it has to do with confidentiality of information and with an uncertainty about what's going to be done with that information. So keep that in mind as you collect data, that there's a limited number of eyes that might see that data, or how the data will be accumulated and shared, things along that nature. That's where their concerns generally come from my experience.
As this thing gets legs and as this thing starts running, what's going to happen with this is that producers will become more comfortable with and confident in sharing that information, because they'll see that there won't be those repercussions, those issues of confidentiality. That will help inform states. It'll help inform USDA. That big circle of data information with producer confidence that they can get into this thing, and they'll see that it's helping them instead of putting them at risk. That's the whole deal.
goes along, even thinking back to the quality assurance program. I'm with, Senator Fred Hudson, the drug administration, and we worked with support folks because we knew that it was better to have the industry doing it, because, there's always that, I'm the government, I'm here to help you thing, and everybody's going to close it up, but I think this is fabulous that you all are spearheading this, so everybody's going to feel more comfortable.
That's the goal. Everybody's going to feel more comfortable, and pigs are going to be healthier. That's the deal.